Hi, I'm Amanda Nelson with the University of North Carolina at Chapel Hill, and I'm happy to introduce you to our paper, Features of Knee and Multijoint Osteoarthritis by Sex and Race Ethnicity. This is a preliminary analysis from the Johnston County Health Study, which is ongoing, and was led by a medicine resident at the time, Sherwin Novin, who's now a rheumatology fellow. This study enrolled the first 544 participants from the main study, and we did two preliminary cross-sectional analyses. One focused on multiple joint osteoarthritis and patterns in this population-based cohort, and the other in features of knee osteoarthritis. As a reminder, a population-based cohort is not enrolled based on symptoms or disease, but rather just individuals who are enrolled in a survey manner from a community, in this case, Johnston County, North Carolina. We also had a focus on sex and race differences in this analysis. So you can see in the flowchart how the 544 individuals were selected. As our typical population is, it was about 2/3 women. We are working hard to enroll younger individuals in the Johnston County Health Study, so the mean age is about 55. You can also see that there are about 10% Hispanic individuals, which is a focus of our new enrollment as well. The BMI there is 32. For the first part, patterns of multiple joint osteoarthritis, we defined these based on our prior systematic review and looked at the hands, hips, knees, ankles, and feet, and found that the most common multiple joint osteoarthritis types in this initial cohort involved 2 or more lower body sites, the knee or hip, and 1 other site, or 3 or more joint sites of those 5. Men had a higher odds of having 3 or more lower extremity sites, but were less likely to have multiple hand sites. That's consistent with our prior work. There were no clear differences by race, although the numbers were small in this preliminary analysis. This study is still enrolling, so we do expect to be able to answer some of those questions. For the second part on knee osteoarthritis, we use standardized fixed flexion PA knee radiographs and our STAIN reader that we've had for over 30 years. And in this part, we see that women had higher odds of radiographic knee OA, more osteophyte sclerosis and lateral joint space narrowing. They also had worse self-reported KOOS symptoms scale scores. Black, compared with white participants, had more frequent and more severe radiographic knee OA, also had more osteophyte sclerosis and worse KOOS symptom scores compared to white participants. Hispanic participants, although they were small in number, seemed to have less severe radiographic OA by the Kellgren-Lawrence method, but similar measures of KOOS, and in some cases, suggestion of higher KOOS scales. To summarize, the Johnston County Health Study represents a unique, diverse population-based cohort of men and women. They have osteoarthritis, and many of them do not have osteoarthritis. They also have the common comorbid conditions that you would expect in a population study. Therefore, this data set allows critical analyses of race and sex differences, social determinants of health, comorbidities, as well as osteoarthritis in multiple joints. As I mentioned, we continue to enroll, and these larger numbers should enable additional subgroup analyses with improved statistical power. But our preliminary results suggest some important differences that do need further study and the pain experience around these subgroups. Again, I'd like to acknowledge our center and our funders, my co-authors, and particularly Sherwin, who's pictured here, and again is a rheumatology fellow and will be one of our rheumatology colleagues very soon. Thank you.